Hello, everybody. Welcome back to another episode of the mental health series we have on the audio and the video platforms. And today we have Bhavini Shah joining in. So she is an director of Mama's Clinic, and it's going to talk about a great topic today. So thank you very much for being here. It's a pleasure having you over here. Thank you. Before starting, that would be great if you can tell about what you do and what's your profession and your work.
I am Dr. Bhavini Shah. I am a gynecologist by profession,
Okay.
and I practice in Mumbai.
Great, wonderful. And yes, before starting, that would be great if you can tell about what is mental health according to you. What do you think is mental health?
When we talk of mental health, primarily I would say it's mental well-being, like physical well-being, where you yourself are at peace and nothing much is really bothering you.
Okay. Yes. Great. Thank you for that. Would you like? Can you give a brief, small brief introduction about what's today's topic and what we're going to speak about?
I'm going to be talking about polycystic ovarian syndrome, which is a very classical problem in the reproductive age group in all women.
Okay.
That I'm talking of right from adolescent to a woman till she becomes menopausal. Okay,
Okay.
so when we talk of polycystic ovaries, instead of one egg forming in either ovaries,
Mm-hmm.
the name suggests polycystic, which means that instead of one, there are multiple eggs growing simultaneously in both the ovaries,
Okay.
and none of them reach a maturity level, because of which then there are problems related to infertility,
Okay.
related to regular periods.
Mm-hmm.
The lady experiences some amount of acne or pimples on the skin,
Okay.
dark skin around the neck area, and hair growth in the chin area, in the mustache area, and in other body parts where we usually do not expect any hair growth.
Okay. Okay. And how can somebody identify that they have something as such in their body?
The first thing that you will notice is the lady starts to either miss periods, and maybe one period in every 2 to 3 months she will get. Once she gets a period, it's either very scanty or
Okay.
it continues to keep flowing for over a month, which is very, very haphazard and erratic in
Okay.
nature,
Mm-hmm.
cannot have a particular cycle. Plus, she will notice there is weight gain. Basically, it's because of the weight gain that these changes start. These are hormonal changes.
Okay.
These hormones then lead to skin darkening of skin and acne on the skin. Hair growth is also because of the weight gain and the male hormone which starts growing. So there is an imbalance in the hormones that happen.
Okay.
Will be a few signs, where you notice acne, you have hair growth in abnormal parts, and you have irregular periods. That's when we can label her as a polycystic ovary.
Okay.
Also, the sonography which can be done,
Mm-hmm.
but not every patient suffering from polycystic ovaries will show up on the sonography, and vice versa. Every patient that will show up a polycystic ovary on the sonography might have no symptoms. She might have regular periods, she might have no acne, no hirsutism at all.
Okay, okay. And what, like, do we have any medical solutions to this, or there are some kind of things?
Yes. So when we talk of solution, if you are looking at a long term and a permanent solution, lifestyle change is the basic requirement.
Okay,
Once there is a drop in just 5% of the body weight, maybe 25 to 30 minutes of daily exercise, and a diet change, the
okay,
first thing that comes back to normal is the periods, and slowly symptoms of these acne and all that go off. Of course, whatever hair growth has already happened, the follicle is already stimulated.
okay,
So that cannot be subsided, but at least it will ensure that there is no further abnormal hair growth.
okay, okay,
When we talk of medications, yes, there are medications. There is symptomatic approach, which will take care of the periods, where we start on hormonal pills which can take care of your periods. But then again, how long are you going to take them? So ideal is to really start some basic lifestyle changes.
Okay.
Along with that, there are medications which will also take care of the insulin levels that go up during polycystic ovaries.
Mm-hmm.
So these medications directly target the polycystic ovaries. But then everything boils down to, these are young girls.
Yeah.
90% of the patient is young girls who suffer from polycystic ovaries, who are not even married yet, neither they have started their family. So starting them on medications this early becomes a little troublesome for the family,
Mm-hmm.
though we know that there are not much side effects to it. But then the family becomes really concerned as to hormone pills for a young girl. Those are the type of concerns that come up.
Okay. Okay. And how does somebody is affected by the mental, like how somebody is affected mentally because of this problem?
When we talk of mental health and polycystic ovaries, most of the time it is body shaming basically,
Mm-hmm.
because of increased weight, and they see their peers, in good shape and no issues. They feel that why am I not like her?
Mm-hmm.
So
Mm-hmm.
to some extent it is genetic, but yes, I would say 80% of it is in our hands. So the mental status gets disturbed only when there are acne all over the face popping up, and you have hair in abnormal areas, in beard and chin areas, where you need to keep either epilating or waxing them. So those are the concerns which then disturb the girl, and she has this feeling of, oh, when am I going to look good, and
Okay.
when is that change going to come up? So
Okay.
that
And does a woman just has hair growth when she has some kind of like these kind of problems in her body, or normally a girl can have hair growth at an abnormal place? Is it all fine also?
So see, for women, it is not normal to have hair in the beard and the male areas. Basically,
Okay.
those are classical. It's called hirsutism.
Mm-hmm.
Those are classical signs of either some hormonal imbalance that is going on. Now, it may not be definitely polycystic ovaries.
Okay.
There are adrenal. There's an adrenal gland just above the kidney, so the hormone coming from there could also lead to these symptoms. So a
Mm-hmm.
thorough evaluation is definitely needed. If too much of some amount is normal, but if you find that it is very obvious beard hair or very obvious chin area hair, definitely it calls for an investigation.
Okay. Wonderful. Wonderful. And what kind of patients have you had, and like how has been like what kind of problems do they talk about, and how do they like how do you deal with them?
Yeah. So see, when a young girl comes to us, all her worry is, when will these pimples go, and my periods, why are they not regular? And there is a myth that because I'm not getting my periods on time, I am putting on weight. So the
Okay.
myth is that it's getting collected, the impure blood is getting collected inside. So we need to counsel them that it's actually the other way around. It's because of the weight gain or the erratic eating habits or the lifestyle that you are living, which is leading to irregular periods. So the minute you lose, say, 5 kg or 5% of your body weight, the first thing that will come back to normal is your periods.
Okay.
That is the young women. Then once the lady is married, again periods is a big issue, because now fertility comes into picture. No period means no pregnancy. So that again becomes troublesome for the lady, that if I'm not getting my periods on time, how will I get pregnant? But
Okay.
yes, polycystic ovaries can be really troublesome to treat at times.
Mm-hmm.
Even after fertility treatments that we do, it is a real challenge to bring out some good quality eggs in these women for
Mm-hmm.
them to become fertile.
Okay.
When we move a little bit ahead in life, maybe say 35 age onwards to 45, 50 years, that is the perimenopausal women. Now, women who have had polycystic ovaries, they are at high risk of cardiac diseases, diabetes in this elderly age, hypertension again. So when once if you have a girl walking into your clinic with symptoms of polycystic ovaries, I think that's the best opportunity for any doctor to
Mm-hmm.
not just ensure that she's getting her periods and she can walk off. That has to be the point where she needs to be counseled that
Mm-hmm.
look, this is not a problem just for now. It's going to remain with you for life if you do not take care of it at this point of time.
Mm-hmm.
And other advantage, I would really utilize this opportunity, because this girl is going to go and talk to her friends.
Mm-hmm.
So by giving her the knowledge about what is PCOD and how it's going to affect her life, I think you are actually talking to 10 more girls.
Yeah.
I think it's better to actually let them know what is the problem and then try and solve their problems.
Okay, okay. And what kind of solutions, like, okay, what kind of message would you like to leave before ending this session up?
So, just one thing, that lifestyle is the most important thing, be it your health, your physical health, your mental health, your immunity. So, I think drinking enough water, up to
Okay.
3 to 3.5 liters of water a day. What else? Exercise, yes. At least 25 to 30 minutes, make it a routine. It
Okay.
has to have a place in your entire day's schedule.
Uh-huh.
And of course, balanced diet. I am not saying do not eat junk or do not eat out. Yes, you can, but then you have to have a calorie check as to, if I have eaten, I am supposed to exercise to compensate for that calorie intake. Because of COVID times, and since you're going to reach out to a lot of public, I just want to give one more message, that is, please build up your immunity. And two, wear a mask. If you're wearing a mask, ensure that you're wearing it properly and taking care of yourself, because now it's more of a community responsibility
Yes.
than just protecting yourself.
Yes. Yes, it is. Thank you very much. So I'm very sorry to, interrupt you and put a question over here. It's like, what kind of diet is good for women who are suffering from PCOS?
Okay. So there is no particular diet that we are looking at.
Okay.
I am talking of a completely healthy, balanced diet.
Okay.
If you know that you're already on the overweight side, all you need to do is increase your protein intake
Uh-huh.
and cut down on your carbohydrates.
Okay.
So when you are taking in complex proteins,
Mm-hmm.
they give you a sense of satiety.
Mm-hmm.
So you do not need to keep eating. When your diet is higher on carbs, carbs get converted into sugars very fast, and you tend to feel hungry sooner, and
Okay.
that's what increase caloric intake. So ideally, there's no for anything, and there's not that you eat this and you are going to treat your PCOD. There
Okay.
is no specific thing,
Okay. Wonderful.
just a healthy balanced diet.
Okay. 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 Yeah. Wonderful. Thank you very much for being here. It was wonderful having you. A great session. Totally different topic. Didn't think this is the thing. To be real, I don't know what really it was, and you made it clear. So thank you very much for that.
Thank you.